So, okay guys, we will start now. So first, I would like to know from all of you, why do you want to join in surgery training? So what do you know about the surgery training? What are the benefits by learning surgery? Anyone? Okay, by the way, my name is Harish Gupta. I am the creator of Passcode 21 YouTube channel. So I have nearly 13 years experience in all specialties, including inpatient, outpatient, SCC, CDI, IVR, and same day surgery. So currently I am working as a ambulatory surgery trainer or same day surgery trainer in one of the MNC in Hyderabad. Okay. So tell me guys, why do you want to learn surgery? Anyone? See, whenever you want to join any type of training, you need to know the target. So if you don't know the target, there is no use to learn. So you need to know the target and you need to try for that. So what is the reason behind joining the surgery training, guys? Anyone?
Hi, good evening, sir. I'm
Yeah,
Lakshmi.
yeah. Go ahead, Lakshmi.
I have experience in ENM and gynecology, radiation oncology.
Yeah,
So
great.
I would like to learn surgery also. That's why
So,
I
so
joined.
in gynecology, radiation oncology also used to code CPT only, na?
Yeah, CPT, ICD both.
But only few specialties you are having the experience, correct?
Yeah, yeah.
So now you want to master in all the specialties, all the series, like 1 to 6, correct?
Yeah, yeah.
Yeah, good decision. So this will be very
Yeah,
useful for you.
I took your class. That is what the recordable.
Sorry? Okay. So Ahmad, yeah, go ahead, Lakshmi.
I, I took your class, but that is recorded class only. That's why
Okay, 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 no problem. Yeah,
thank you. Thank you so much.
yeah, welcome. So I will help you at any cost. Okay. So what about Manoj, Bharat? See, whatever you want to learn, first of all, you need to know the target. Why do you want to learn the surgery training? So without any knowledge of learning surgery, time waste and money waste, correct? Yeah, that is one thing. So now there is a huge demand for surgery coders. Okay. So even on my channel, I have created one video related to what are the benefits of surgery coding. Okay, you might have seen that video. So basically, so if you are having the experience in surgery, you are having multiple opportunities. Okay, I will tell you how. First, if you know the surgery, you can work as a general surgery coder. Okay, so if you know the surgery, you can work as a, for example, if you know integumentary system, you can work as a dermatology coder. Okay, so if you know musculoskeletal, you can work as a orthopedic coder. If you know IVR, like 30,000 series, you can work as a IVR coder. If you know digestive system, 4,000 series, 40,000 series, you can work as a GI coder. And if you know 50,000 series, you can work as a urology as well as OBGYN coder. Next, if you know 60,000 series, you can work as a neurology coder. Why means nowadays most of the companies are asking specialty coders and they are providing work from home jobs. Okay. So for example, one company will ask you, we are looking for neurology coder. There you no need to worry about 1 to 5 series. If you know that 60,000 series, that's enough. Okay. And few companies are asking, we are looking for orthopedic coder. So that time you no need to worry about 1, 3, 4, 5, 6. Just if you learn 20,000 series, so that is enough for that job. So like that, you are having multiple opportunities if you learn the surgery coding. Even you can use this surgery knowledge in denial management coding also. Okay, why means most of the time we will use CPT codes in denial management. Okay, so these are the benefits. Already I have created one video related to all these benefits. If you have not seen those video, you can watch one more time. Okay, so anyone has any doubt here? So if you don't have any doubt, we can start our session. Okay, fine then. So same day surgery live chat training. So this is batch 25. So we will provide trainings in India, US and UAE. Okay. So this is the batch 25. So today we are going to learn colonoscopy live chat training. Okay. So this is the demo basically. So we will learn colonoscopy coding and using one live chat. Okay. So what is colonoscopy, guys? Anyone knows?
To enter the scope into the colon.
Yeah, that is correct. So yeah, correct. So we need definition. What is colonoscopy?
Scopy means it's a visible camera, and we through this procedure we can see the structure of the colon
Yeah,
inside the
perfectly.
structure of the colon.
Yeah, correct. So scopy means examination. Okay. So here physician will see the internal organs indirectly. So he can't see directly. On the monitor he can see. So colonoscopy. So here other name for colon is large intestine. Correct. So here physician is going to perform examination of the large intestine. During the examination, if he found or if he find any abnormalities, he will remove those abnormalities. So this is the colonoscopy instrument. So this is the monitor. So physician will insert this colonoscopy through the patient's anus and he will check in the monitor. So this is the typical colonoscopy monitor. Okay. So next, this is the colon. Okay, so this is the colonoscopy here. This is the colonoscope. So this is the anus. Physician insert the colonoscopy or colonoscope through the anus. Okay, so these are the light. So every colonoscopy is having one light here. So using that light, patient will visualize these polyps here. So here patient is having one polyp. Okay, and this is the splenic flexure. This is transverse colon. This is hepatic flexure. This is ascending and this is cecum. So we'll learn all those things. If you see the colonoscopy endpoint, this is the lens. Okay. So this is the irrigation medium. So this is the instrument port. This is the light. Okay. So this is the typical colonoscopy instrument. Okay. So now we need to check colonoscopy anatomical parts. Okay. So whenever we see or whenever we want to code any type of live chat in same day surgery coding, we need to understand anatomy of the body part. Okay. So here this is the typical colon. So for example, if you want to code colonoscopy, then before coding colonoscopy chart, you need to understand and you need to know the anatomical parts of colon. So first, this is the anatomical part of colon. Okay. So this starts with anus. So this is the starting point for insertion of colonoscope. Okay. After the anus, we are having rectum. Okay. So this is sigmoid colon. This is the flexure. So this is the sigmoid colon. Next we are having descending colon. So this is descending colon. This is left splenic flexure, left colic flexure or splenic flexure. This is transverse colon. Okay. So this is right colic flexure. This is ascending colon. This is cecum. This is appendix. So here after the cecum we are having ileum. Okay. So this is very important. So ileum comes under small intestine. Okay. So cecum comes under large intestine. So there is a junction between small intestine and large intestine. Most of the typical colonoscopy reports, you will find ileocecal valve. Okay. Where there is a valve between small intestine and large intestine. Okay. In the documentation, if we see, I have reached cecum or ileocecal valve. So you need to confirm that physician has examined total colon. Okay, so this is the landmark in order to complete the colonoscope. Okay, so these are the codes 45380. Okay, so these are the codes related to this colonoscopy. We will see all this during live chat coding. Okay, so now we will see one live chat related to colonoscopy. Okay, so in the typical, so this is basically 100% live chat. So here, if you see here, so first, whenever you code any chat, you need to check for past medical history. Okay, so this is the past medical history. So from here, you need to code all secondary diagnosis, all, or you need to code all chronic conditions. So here you can code obesity, you can code essential hypertension. Okay, so next, these are not necessary. Just here you will code essential hypertension as well as obesity, and already BMI is mentioned here. You need to code BMI also. Okay, so these are from past medical history. You need to code in the ambulatory surgery coding. Okay, so next you need to check for surgical history. Okay, so like, so most of the time you need to code, so what do you call, status codes, like hip replacement, knee replacement, okay, dialysis status, all those status codes you need to code from past surgical history. Okay, so next you need to code colonoscopy. Before going to colonoscopy, you need to assign the PDX. Okay, so that PDX you need to take from pathology report. So this is the surgical pathology report. From here, you need to code for ICD-10 CM diagnosis. Okay, so this is for medical necessity. So whenever you code colonoscopy report, just you need to find what is the reason for this colonoscopy. Okay, so here, from here you need to code primary diagnosis. Okay, so like this. So here, for example, if you see this one, endoscopic biopsies, colonic mucosa within normal limits, means there is no problem in the colon. Okay, so colonic mucosa within normal limits, there is only minimal submucosal tissue. Okay, so here also there is no problem in the colon. Okay, so these are the findings. Now we will see this one, typical colonoscopy report. Okay, so here, post-op diagnosis, high risk colon cancer surveillance, personal history of colon polyps. Okay, so next you need to check post-op diagnosis. So one more important thing is, you can't code from pre-op diagnosis. Okay, always 100% you need to code from post-op diagnosis as well as pathology. Okay, so basically pre-op means before the colonoscopy. Okay, post-op means after colonoscopy. So if you see colonoscopy post-op diagnosis, they have mentioned 1 5 mm polyp in the cecum, removed with cold biopsy forceps, resected and retrieved. So submucosal nodule in the cecum, likely due to external compression. Okay, so from surrounding structure biopsied. Okay, so from this biopsy, physician sent samples to the histopathology. Okay, now we are having this specimen correct, surgical pathology report. So this is related to this one, submucosal nodule in the cecum and from surrounding structure biopsied. So after performing the biopsy, physician will send samples to the histopathology or surgical pathology department. There they will check using the microscope and all other modalities, and they will find the abnormalities. In this case, patient does not have any abnormalities. Okay, so here if you see this one, patient's reason for admission is high risk colon cancer surveillance. Okay, so here we need to code for Z1211 for high risk colon cancer surveillance. Okay, so next we have checked pre-op diagnosis and post-op diagnosis, and we have checked pathology. Okay, now we need to check operative report. Okay, so medicines, see the anesthesia note for documentation of the administered medications, complication, no immediate complication. So physician is telling, so I have performed the colonoscopy, but there are no complications. Okay, so this is the typical procedure. So after I obtained informed consent, the scope was passed under direct vision. So what is the starting point for this scope, guys? What is the starting point for
NS.
colonoscopy? Yeah, Yanas, correct. So here physician started the colonoscopy and he inserted colonoscope into the anus. Okay. So throughout the procedure, the patient's blood pressure, pulse and oxygen saturations were monitored continuously. Okay. So the adult colonoscope was introduced through the anus. Okay. Advanced into the cecum, identified by appendiceal RPs and ileocecal valve. So tell me, so already we have discussed whether it is complete colonoscopy or half colonoscopy, incomplete colonoscopy.
Complete colonoscopy as ileocecal wall
Yeah,
is there.
perfect. Yeah, perfect. So this is a complete colonoscopy. Okay. So he is telling that I have inserted the colonoscope through the anus and I have examined sigmoid colon, descending colon, left colic flexure, transverse colon, right colic flexure, ascending colon. In order to reach cecum and ileocecal valve, he need to cross all these body areas. Okay. And he is directly telling that I have reached the cecum and or ileocecal valve. Okay. So that means here physician has performed complete colonoscopy. Okay. So now we will go again into the operative report. Okay, fine. So the colonoscopy was performed without difficulty. Okay. So the patient tolerated the procedure well. As already physician mentioned, here there are no complications, correct? So here also physician is telling the patient tolerated the procedure well. The quality of the bowel preparation was evaluated using the BBPS, Boston Bowel Preparation Scale, okay, with scores of right colon 3, transverse colon 3 and left colon 3. Okay. So total BBS score is 9. So estimated blood loss none. Okay. So here physician also telling that there is no blood loss. Okay. Next, always in endoscopy procedure, after performing the endoscopy procedure, patient must and needs to provide the findings. Okay. So this is the live chat as I told. So here also patient is provided the findings. So he is telling that I have seen a 5 polyp was found in the cecum. Okay. So the polyp was sessile. So the polyp was removed with a cold biopsy forceps. Resection and retrieval were complete. Okay. So one large submucosal nodule was found in the cecum. Suspect likely from external compression from surrounding structure. So biopsies were taken with cold forceps for histology. Okay. The retroflexion view of the distal cecum and anal was normal and showed no anal rectal abnormalities. Okay. So now we have completed everything here. Okay. Now we know the findings. So what did the physician perform, guys, here? So what happened here?
Uh,
Polyp removal.
well,
Yeah, excellent. Polyp removal. Okay. So now directly we need to go to the, so here first we need to understand the keywords in order to code this operative report. So our first keyword is this one. So the adult colonoscope was introduced through the anus and advanced to the cecum, identified by appendiceal RPs and ileocecal valve. This is one keyword. Why means here physician is telling I have completed complete colonoscopy. Okay. So this is most important keyword. Okay. So this is keyword 1. Okay. Next, this is the second keyword. A 5 polyp was found in the cecum. So where is the cecum here? So physician is telling I have found polyp in the cecum area. So this is the cecum. In this area, physician identified the polyp. Okay. So next, the polyp was sessile. So this is the third keyword. The polyp was removed with a cold biopsy forceps. Okay. So this is the third keyword. So physician is telling, so I have performed the colonoscopy. During the colonoscopy, I have identified the polyp in the cecal area and using the colonoscopy, I have removed the polyp using the cold biopsy forceps. Okay. So resection and retrieval were complete. Okay. So like that. So one large submucous nodule was found in the cecum. Suspect likely from external compression. Okay. So here we need to code this cecum biopsy. So here we need to code only polyp removal. Why means this biopsy and polyp both are performed in the same location, correct? So here we need to code for only polyp removal. So first we have identified our post-op diagnosis. Okay. So here also same mentioned 5 centimeter 5 millimeter polyp in the cecum removed with cold biopsy forceps. So this is one keyword. So in finding also they have mentioned the same keyword. So Next, we need to go to our CPT index. So directly we will go to anatomical area. So what is the anatomical area, guys, here? Where is the physician perform this procedure? Where is the polyp removal performed?
Colon. Colon.
Yeah,
Colon.
colon. So directly you will go to colon. Okay. So here you are having colon. So 1 second, someone visited. So colon. So what did physician perform in colon?
Polyp
Remove
removal.
polyp.
Yeah. So here you need to go to removal. Okay. So here our anatomical location is colon, correct? So here you need to click on removal. Okay. So here, so what did physician remove?
Polyp.
Yeah,
Polyp.
polyp. So you need to check all these codes. Okay. Okay. 45384. Okay. So what is this one? So this is for hard biopsy forceps. So what is our technique in the operative report?
Cold biopsy.
Yeah, cold biopsy forceps. Okay. So now we will see our CPT book. Okay. So this is the CPT book. Okay. So if you see here, colonoscopy starts with this dictionary we will learn during our live training. So this one is very important for our interview purpose. We will learn this one during our training. So colonoscopy starts with 5 4 5 3 7 8 diagnostic colonoscopy. Next, removal of foreign body. Okay. Next, 45380 with biopsy simple or multiple. Okay. Next, 45381 EMR, directed submucosal injection any substance. Only injection of the substance with 45382 with control of bleeding any method. So here 45388 with ablation of tumor, polyp or other lesion. Okay. See here. So this is very important. With removal of tumor, polyp or other lesion by hard biopsy forceps. Okay. Next, we are having one more code, snare technique. So based on our operative report, this is cold biopsy forceps, correct? So here we need to code this one, 45380. So this one, colonoscopy with biopsy single or multiple. Okay. Irrespective of number of biopsies, we need to code this one, single or multiple. So here our code is 45380. Okay. So if the physician performs hard biopsy, which one you will code, guys? Which code you can use?
45384.
Perfect. So what if the physician in the documentation they will mention, I have used the snare technique?
45385.
Yeah, perfect. So 45385. So now tell me, so this is the colon, correct? So in sigmoid colon, physician used hard biopsy forceps. In the ascending colon, physician used like snare polypectomy. How do you code this scenario? So in the interview, they will ask you like that only. So physician has performed the sigmoidoscopy, sorry, colonoscopy. During the colonoscopy, physician you like identified one polyp in the sigmoid colon. Okay, and they will ask you one polyp in the sigmoid colon. Here physician is performed hard biopsy forceps, and one polyp in the ascending colon. Here physician has performed snare polypectomy. How do you code this scenario? So anyone knows, guys? So it's easy. Here you need to code two codes. Okay. So 453 you need to code two codes. 45384 for hard biopsy and 45385 for snare technique. Okay. So the reason for this is here physician has performed different procedure different techniques in different anatomical locations, correct? So here we need to code 84 as well as 85. 84 is for hard biopsy forceps polypectomy and 85 is for snare polypectomy. Okay. So like that you need to tell the interviewer. So I will code two codes for one for hard biopsy forceps or hard biopsy polypectomy and next one is for snare polypectomy. Okay. So like that you need to tell the interviewer. So I will code two codes. In another question, physician will ask you. So physician has performed polypectomy in the transverse colon. In the same location, physician has performed the biopsy also. How do you code this scenario? So will you code biopsy separately or not? So that time you need to tell them. So here we will not code biopsy separately. Why means in the same location patient is performing polypectomy also. Correct? So here you can't code the biopsy along with major procedure which is polypectomy. Okay. So that is the guideline. Okay. So this is the live chat. So like this we need to code the surgery reports. So in our training you are going to know nearly 45 to 50 live chats. Okay. In our training you are going to learn all these things. So these modifiers are very important. So you are going to learn all the modifiers along with example scenarios, and here you are going to learn NCCI edits using the software, and you are going to learn common interview questions for integumentary system, musculoskeletal, respiratory, digestive, urinary, male and female system, and delivery and nervous system, eye and ear. And as I told you, so you are going to learn nearly 45 to 50 live chats using the keywords. Okay. So next I will tell you most common interview Q&A for same day surgery interviews. Okay. Next surely I will provide 100% job assistance in India, UAE and USA. Okay. So from my side I have completed.